Well, today, we're delving into a group of serious lung conditions known as alveolar hemorrhage syndromes. These syndromes involve bleeding into the tiny air sacs of your lungs, the alveoli, and can have significant consequences. We'll explore what causes them, how they affect your body, and the available treatment options. The causes of alveolar hemorrhage syndromes are diverse. Often, these conditions stem from autoimmune disorders where your immune system mistakenly attacks your own body. Well-known examples include Goodpasture syndrome, where antibodies target the lungs and kidneys; granulomatosis with polyangiitis, previously known as Wegener's granulomatosis, which causes inflammation of blood vessels in the lungs, kidneys, and other organs; and systemic lupus erythematosus, also known as lupus. Besides autoimmune disorders, certain infections, drug exposures, and even exposure to toxins can trigger alveolar hemorrhage. In some cases, the cause remains unknown, referred to as idiopathic pulmonary hemosiderosis. The core problem in alveolar hemorrhage syndromes is the leakage of red blood cells into the alveoli. This bleeding disrupts the normal gas exchange process, making it difficult for oxygen to enter your bloodstream and carbon dioxide to be expelled. Over time, repeated bleeding can lead to inflammation, scarring, and the buildup of iron in the lungs, a condition known as pulmonary hemosiderosis. This iron accumulation further damages the lung tissue, reducing its capacity to function effectively. The severity of the syndrome can vary depending on the amount of bleeding and the underlying cause. Alveolar hemorrhage syndromes are relatively rare, but their exact prevalence is difficult to determine due to variations in diagnostic criteria and the fact that many cases may go undiagnosed. Goodpasture syndrome, for example, is estimated to affect about 1 in a million people. Granulomatosis with polyangiitis has a slightly higher prevalence. These conditions can affect people of all ages, but some, like Goodpasture syndrome, are more common in younger adults, while others, like granulomatosis with polyangiitis, can occur at any age. There doesn't appear to be a strong predilection for one gender over another, though some studies suggest a slightly higher incidence in males for certain types. The signs and symptoms of alveolar hemorrhage syndromes can vary in severity and presentation. Common symptoms include shortness of breath, often worsening with exertion, cucking, sometimes producing blood or blood-tinged sputum, fatigue, and chest pain. Anemia, or low red blood cell count, is also a frequent finding due to the chronic blood loss into the lungs. In more severe cases, patients may experience acute respiratory failure, requiring mechanical ventilation. Furthermore, depending on the underlying cause, other symptoms may be present, such as kidney problems in Goodpasture syndrome or sinus and nasal inflammation in granulomatosis with polyangiitis. Diagnosing alveolar hemorrhage syndromes requires a combination of clinical evaluation, imaging studies, and laboratory tests. A chest X-ray or CT scan can reveal lung infiltrates or opacities, indicating bleeding in the alveoli. Bronchoscopy, a procedure where a thin, flexible tube with a camera is inserted into the airways, allows for direct visualization of the lungs and can be used to collect fluid samples for analysis. Analyzing these samples, known as bronchoalveolar lavage fluid, can reveal the presence of red blood cells and hemosiderin-laden macrophages, which are indicative of alveolar hemorrhage. Blood tests are crucial to identify antibodies specific to certain autoimmune disorders, such as anti-GBM antibodies in Goodpasture syndrome or ANSA antibodies in granulomatosis with polyangiitis. In some cases, a lung biopsy may be necessary to confirm the diagnosis and rule out other conditions. While we've touched upon the major players like Goodpasture syndrome and granulomatosis with polyangiitis, it's important to recognize that alveolar hemorrhage syndromes aren't always neatly categorized. Some cases are associated with other systemic diseases, medications, or remain idiopathic. Therefore, the classification is often guided by identifying the underlying cause or associated condition. For example, you might encounter descriptions like drug-induced alveolar hemorrhage or lupus-associated alveolar hemorrhage. Understanding the context in which the bleeding occurs is essential for guiding the most appropriate treatment strategy. The primary goal of treatment is to control the bleeding, reduce inflammation, and manage any underlying autoimmune or infectious processes. Treatment often involves a combination of medications, including corticosteroids to suppress the immune system, immunosuppressants like cyclophosphamide or azathioprine to reduce the immune system's activity, and in some cases, plasmapheresis, a procedure to remove harmful antibodies from the blood. Supportive care, such as oxygen therapy or mechanical ventilation, may be necessary in severe cases to maintain adequate oxygen levels. Addressing any underlying infections or discontinuing offending medications is also critical. Regular monitoring and follow-up are essential to assess treatment response and manage potential complications. Currently, there are no definitive preventative measures for alveolar hemorrhage syndromes, particularly those caused by autoimmune disorders. However, avoiding exposure to known triggers, such as certain toxins or medications, may help reduce the risk in some cases. Early diagnosis and prompt treatment are crucial to minimize lung damage and improve outcomes. Individuals with underlying autoimmune conditions should work closely with their healthcare providers to manage their disease effectively and monitor for any signs or symptoms of alveolar hemorrhage. The prognosis for alveolar hemorrhage syndromes varies depending on the underlying cause, the severity of the bleeding, and the promptness of treatment. With early diagnosis and appropriate management, many individuals can achieve remission and maintain relatively good lung function. However, some patients may experience recurrent episodes of bleeding or develop chronic lung damage, leading to long-term respiratory problems. Recent research focuses on developing more targeted therapies to suppress the immune system while minimizing side effects. Studies are also investigating the role of biomarkers in predicting disease severity and treatment response. Ultimately, a multidisciplinary approach involving pulmonologists, rheumatologists, and other specialists is essential to optimize outcomes for individuals with alveolar hemorrhage syndromes.